Pauline Isabel Centeno from BSN 2A, and today I will demonstrating cardiovascular breast and axilla assessment. So the materials needed for this one is stethoscope, so the pillow, watch, and notepad and pen. For assessment, we need to identify the client, so we can ask the name of the client. What is your name, sir? Okay, thank you, sir. This is to avoid medical error and to confirm if the procedure is appropriate to the client. So next, we need to explain how the patient cooperates. So, sir, today I will assessing your cardiovascular, breast, and axilla. So is that okay, sir?
Yes.
Okay, sir. So all you need to do is to follow my instructions, and don't worry, I will guide you in every procedure. So this is to lessen the anxiety of the patient and to assess the body easily. So next one is to plan. So we need to perform hand hygiene by washing our hands with soap and putting alcohol in our hands. This is to avoid transmission of microorganisms and to prevent illnesses. So next one is we need to provide privacy. We can close the doors and curtains. This to provide respect, enhance autonomy, prevent economic harm, embarrassment, and discrimination, and to avoid the client from external noises. So in assessing cardiovascular system, the first thing we need to do is to know where is the location of pulsation, like the aortic area, pulmonic area, tricuspid area, mitral area, and epigastric area. So the first one is we will simultaneously inspect and palpate the aortic and pulmonic area. So in inspecting the aortic, so we can find it in the second intercostal space at the right side of the sternum of the patient. So we just palpate using our hands. So next one is we will go to the left side where is the pulmonic area. It is located in the left sternal border in the second intercostal space. So here, from here, we will just note the presence and absence of pulsation between the two areas. So upon inspecting and palpating, so I don't observe any pulsation, and so it is normal. So next one, we need to inspect and palpate tricuspid area for palpation and hips and nips. So the tricuspid area is found at the fifth intercostal space in the left side of the sternum, close to the sternum between the right atrium and right ventricle. So here. So upon palpating, so we don't observe any pulsations, so we can consider it normal. So if we observe any pulsation in this area, so we can consider it abnormal one. So next one is we need to inspect and palpate the apical area. So the apical area is also known as mitral area. So it is found at the fifth intercostal space at the mid-clavicular area. So here, from here. So upon palpating and inspecting the apical area here, so it is palpable. So I feel the pulsation. About 50% of the adults has visible pulsation in this area, and the points of maximum impulse can be felt in the fifth lower intercostal space or the mid-clavicular line. And there is also a normal diameter, so between 1 to 2 centimeters only. So as we inspect the client, there is no lift and heave. So the abnormal findings for this one, if the points of maximum impulse is laterally or slower, that indicates enlargement of the heart. If we inspect the diameter is over 2 centimeter, we can evaluate the patient has enlargement of the heart or aneurysm. So there is no heave or lift observed lateral in apex, and we can consider it or that there is an overactivity of left ventricle. So the next procedure is we need to inspect and palpate the epigastric area at the base of the sternum here for abdominal aortic pulsation. So epigastric area is found at the upper central region of abdomen here between the costal margin here and subcostal plane. It is found cycloid process. So here, so we just palpate it. So upon palpating the epigastric, there is an aortic pulsation and the client exhale. So we can observe the epigastric area is moving. So we can consider it normal. So the next one is we need to auscultate the heart in all 4 anatomical areas: the aortic, pulmonic, tricuspid, and apical or the mitral area. So the first thing is we need to eliminate the sources of room noise. So we need to provide silent environment when we assessing this one, because the heart sound is very low intensity and difficult to hear if the area is or the room of the patient has a loud noise. So next is we need to keep the patient in supine position with head elevated 30 to 40 degrees. We can use a pillow to elevate the head of the patient. So 30 to 40. So like this one. So next one is we need to warm up our stethoscope so that the patient will not be shocked in the cold temperature of the stethoscope. We just need to use the bell of the stethoscope to listen the 4 heart anatomical areas. So we will just use bell to warm it up in the aortic area of the patient. So on the left side is the pulmonic area. Down to the tricuspid area. And we will go down to the apical area. So after that, examining the patient in supine position, we can ask the client to sit down. Sir, can you sit down? Thank you, sir. So we will just examine the all 4 pulsations. So we will start, so warm it up. Start in the aortic area. So in the pulmonic area, in the tricuspid area, in the apical area. So upon auscultating, so we observe that the heart sound of the patient is more audible in certain position, and the systolic and diastolic are both in silent interval, and systole and have shorter duration than diastolic, and the S1 and S2 or the lub or dub sound is also heard. The S1 is more louder than the S2, so the S2 is more louder at the base of the heart. So the S3 is only visible in younger or children. In S4 is also visible in older. So the normal findings, there is an increase or decrease intensity in any area. So there is no varying intensity in different beats. So there is an S3 heard in older adults, and the S4 is maybe sign of hypertension for adults. So next one, we need to palpate carotid artery with extreme caution. So in palpating carotid artery, so we can ask the client to move his head on this sideward. So we just palpate the carotid artery in extreme caution. So upon palpating the carotid artery, so there is an observed symmetric pulse volume. So there is decrease and increase pulsation. So the quality remains same even the client is breathing. So we can ask the client to go back at the supine position. So move again the head. We palpate the carotid artery. So it's the same if there is a symmetric pulsation. There is no increase of pulsation. So thank you, sir. So next one is we need to auscultate the carotid artery. So in auscultating the carotid artery, we need to first warm again the stethoscope. So we will just use again the bed of the stethoscope. We just place it in the carotid artery of the patient. So okay, sir. Can you inhale and exhale? So another one. Inhale and exhale. So okay. So upon auscultation, there is no sound heard and there is no presence of blood in one or both carotid arteries. So next one is we need to inspect the jugular vein distension. So we can ask the client to sit semi-fowler position with head supported a small pillow. So as we can see, so there is no visible jugular vein. The right side of the heart is functioning normally. So the abnormal finding for this one is the veins are visible. So the next one is we need to palpate peripheral pulses and take note for its rhythm. So the peripheral pulses including the carotid, the brachial, the medial, femoral, popliteal, posterior tibial, and dorsalis pedis. So for this one, I will just check for radial pulse of the patient. So using our watch, we can just observe the number of pulsation in the whole 1 minute. So we will just start now. So upon palpating the radial pulse, so I got 75 beats per minute, so it was normal. So I don't observe any tachycardia, bradycardia, or any irregular rhythm upon palpating. So we can do it in the legs, like in femoral or popliteal. So we will just inspect the popliteal pulse area in the leg. So you can start now. upon palpating the popliteal pulse. So we got 73 beats per minute, so we can consider it also normal. So we will now proceed in palpating peripheral veins in the arms and the legs for the presence of superficial veins and any signs of gravities. So we can assess the axillary veins in the arms, the basilic vein, the cephalic vein, radial antecubital vein. So in the legs, we can also palpate the femoral vein, popliteal vein, anterior tibial vein, posterior tibial vein, and dorsa venous vein. So we will just palpate the basilic vein. So in the legs, we just palpate again the popliteal vein. And this one, upon palpating, I don't feel any evidence of tenderness in the swelling, and there's no also redness and no signs of infections. So we will now proceed for assessing the breast of the client. So inspect the breast for size, symmetry, contour, or shape while the client is sitting in position. So we can ask the client first to sit down. Sir, can you sit down? Okay, sir. So we will now inspecting your breast. So as you can see, since my patient is male, so the breast is even in the chest wall. So the patient is obese, so we can see that there is a similar in shape to the female breast. So however, in the females, so here, so we can see that there is a round shape, slightly unequal size in right and left side. So most of the people are very confused between this size because the normal size for the female is unequal for both sides. So it is not equal, so it is unequal size. So as you can see, I don't see any swelling. So there is no asymmetry and there is no recent changes in the breast size. For example, the patient undergo in a procedure or the patient had removed breast when our client have breast cancer. So as you can see, there is no recent changes in the breast size. So for example, another example is when the patient is pregnant, so we observe that the patient have a more bigger breast size, so it is normal. So next one, we will now inspect for the skin of the breast, for discoloration, for hyperpigmentation, so dimpling or swelling or edema. So as we inspect the breast, so the skin is uniform in color, so it is the same in the abdomen or the back of the patient, and the skin is smooth also and also intact, and there is a symmetric or horizontal or vertical pattern in light skin people. So I don't see any also discoloration or hyperpigmentation to the breast, so there is no retraction which result for scar tissue or invasive tumor in the breast, so there is no unilateral or localized hypervascular areas which is associated in increase in blood flow, and there is no swelling or edema, and So we can consider the patient has normal breast. So next one is we will now inspect for areola for size, shape, symmetry, color, and masses or lesion. So as we observe, the patient has a round oral and the same to other side. So it is dark brown. So the patient has the same brown color. So when the patient is light in color, so the areola is pink. So there is now also irregular placement of sebaceous gland in the surface of areola, which is indicate Montgomery's tubercles. So I don't see also any presence of masses and lesions to the areola. So next one is we will now assess the nipple of the patient. So we will now inspect the nipple for size, shape, color, discharge, and lesions. So as you can see, it is round. So it is also everted, equal in size in both sides, and it is also has the same color. It is also smooth. So both nipples point are in the same direction. So as you can see, there is no discharge for the inversion of one or both nipples. So abnormal findings for this one is the nipple is not the same in size. So and also in color, there is also presence of discharge, rust or crack, and there is lesions, masses, and tenderness. And there is a recent inversion upon or one or both nipple. So next one is we need to palpate the areola, nipples, and breast for masses. So in doing this one, we need to do 3 breast palpation. So the first thing we need to do is hands of the clock or spoke on the wheel. So in doing this one, we need to expose the breast of the patient and we need to palpate using the hands of the clock or spoke of the wheel. So the first one, so speak of the wheel. So 1 to 12, so we just palpate it, so warm the hand. So and as we go to the center, and nipple area. So on the left side. So next, breast palpation is the circle pattern. So we just make a circle shape around the nipple of the patient. So we will just palpate for the masses. So on the upper part, as we go to the next axillary. So on the left side, circular pattern. So on the upper side. So next one, we need to ask the client to go back again in supine position. So sir, can you lay down? Okay sir, thank you. So we just do the vertical stir pattern. So we will start near axillary. So we just go down, then go upward, go down again, go upward, so go down, so go upward, so go down, and go upward. So go down again, so go upward. So next, we will do the same thing on the left side. So near at the axillary, so go down, go upward, go down, So next is we need to palpate the axillary, subclavicular, and supraclavicular lymph nodes. So in doing this one, you ask the hand to sit down. So place the arm of the patient in abduction and support the forearm the patient using a wall forma. So it first. So we will just palpate using our fingertips to palpate 4 areas of axilla. So the first part is the edge, the greater or pectoral muscle along the anterior axillary line. So next one, we need to palpate thoracic wall in mid-axillary area, in upper humerus, anterior edge of latissimus dorsi muscle along the posterior axillary line. So on the other side, the edge and the great pectoral muscles in the thoracic wall, the upper part of the humerus, and anterior edge of latissimus dorsi muscle. So thank you, sir. So sir, you can place back your clothes. So thank you for cooperation. So in this one, so I don't observe any palpable nodules or masses. There is no enlarged. There is no also tenderness, and I don't see any infections upon palpating. So we can consider it normal. So for evaluation, we can evaluate the findings from physical assessment if it is in the normal range. So it is to determine if the nursing orders are needed to change or completed. So we will now to document and report significant findings. So this to provide accurate reflection of nursing assessment and to record information that can have to support proper treatment of the patient or the client. So that's all. Thank you po.